right, everyone. Thank you for joining us and welcome to another segment of this great program coming to you live and direct from the African Portal Radio TV International. This is El Talk on the African Portal. You know, every Wednesday we come out to be part of this great moment to sensitize our community and also to educate our people about your health because we believe that your health and lifestyle is very important. And this is the hour that we are going to be talking about it, your health. And this week, we are going to be talking about a very important topic. But before we dive into it, let's quickly see what we have for you on the African Portal. Let's come in with some introduction. Thank you all for joining us. I really appreciate your time on the African Portal Radio TV International. My name is Dario Lusa, and I'm going to be your moderator for this program for this hour. Please join us. Let's do it together. It's going to be another great time. Your health is very important. And I always pray that when money comes, health will not be our problem. Because I read an article this week that says that every person have one or two things to do until when they start having health problem. That is when they see that health is very valuable. I don't want you to wait till then. I don't want you to wait till when you start having health problem before you start thinking about your health. It's time now to educate you, to sensitize our community about your health. Working 24/7 is not good for your health. You need to have time to rest. And at the same time, what you put in your mouth is also very important. And at the same time, you need to know how your body is. You need to understand your body. And this will be part of the thing that we are going to be discussing on this program this hour. Remember that the great leader of our time, Dr. Ademola Tosin Ojo, is the one that paid for this hour. And every Wednesday, we're going to be here to be having this program. 13 weeks. This is the 5th week of this great program. And we've been having conversation on different topics. Last week, we talked about malaria, and a lot of people have been responding to it. As a matter of fact, it have gone viral on many newspaper, international newspaper, both international and local, especially in Nigeria. Tribune newspaper pick it up on Sunday, publish it, and talk about it. And at the same time, on Monday, also one of the leading newspaper, Independence, Daily Independence, also talk about it. And we also have bloggers that have been blogging this topic since last week. So this week is going to be another great week that we are going to be talking about health and things that have to do with your life. This is Health Talk on the African Portal Radio TV International with Dr. Ademola Tosin Ojo. That's all. Kindly watch and share. Call the studio line on +27 84 248 3384. This is the time. Let's get to it. When we say stroke, warning, sign that can save a life, what exactly should every person watching this program knowing about recognizing a stroke before it's too late? That will be one of the important things that we are going to be talking about on this program. So join me to welcome the man that is capable. He always here every Wednesday, same time, to educate us, to sensitize our community, especially about your health. And I'm so excited about it because we have a great leader that concerned about people's life, that concerned about people's health. He have a very busy schedule, but with that, he still give time to say, let me reach out to my community. It's not only about money. I know many people today, especially the politicians, that believe that the best way to reach out to people is to give them money. Some people believe that the way to empower people is to give them money. They say stomach infrastructure. That is what they call it. But we realize that the best way to help the community is to educate them, is to let them know how they can live a healthy life. And that is exactly what this great leader is doing, to sensitize the community, to invest in time, not only is material, it's time to educate the community. So it will be my pleasure if you can join this program today as well and also share this program across the globe. Remember, the more you share this program, the more you give it opportunity to go viral. So let me welcome everybody, no matter where you are. I greet you according to your time zone. I greet you according to your language. And I greet you according to where you are. If you're in the afternoon, I greet you afternoon. And I said Dumila to everyone. Assalamu alaikum wa rahmatullahi wa barakatuh to everyone. Listen to us in central and northern part of Africa. And I say Abarisa to everyone listening to us in East Africa. I greet every one of you. Welcome to the African Portal Radio TV International. Thank you for joining us. I really appreciate your time on this program this hour. Thank you. Let's get to the business of the day. Let me welcome my guest to the studio. Welcome, Dr. Ademola Tosin Ojo. Sir, thank you for joining us again this week. I really appreciate your time, and I also appreciate the effort you are putting together to make sure that this program is continued. Some people will be saying that it's not possible. They can't do it for 13 weeks. By the time they do it in 3 weeks, they will get tired of it. But we are not tired. Instead of us getting tired, we have more energy because we have a lot that takes to sensitize our community and our society. And that is exactly what we are doing. Thank you for your time. I really appreciate it. Kindly introduce yourself to the listeners at home. I know you have a lot of qualification, very qualified, but sometimes I told myself, let me allow Doctor to introduce himself because he can do it better than I do. Sir, kindly go ahead and introduce yourself to the listeners at home.
Good day, once again, moderator, and good day at home to our listeners. We appreciate you guys and your passion and the energy that you've put into, following us has kept us going. We love that and we appreciate it so much. Thanks. The same person that I've started with the moderator, still Dr. Ademola Tosin Ojo. I'm a gynecologist by profession, but I've ventured into various aspects of medicine. And that's why I'm here to talk about other various aspects that are not directly to my domain. Thanks for having me. This is another day. Looking forward to having a great time. Please listen, stay tuned.
All right, thank you. Listen, stay tuned. That is exactly what we are talking about. So if you are joining us, kindly share this program. Let it go viral. The more you share it, the more you give it opportunity to go viral. Remember, this is very important. Why? Because we're talking about what will make you live long on this earth. God have given us this land, and it said that we should exploit and enjoy the land. So for you to live long here, your health is very, very important. And this week, we have a very important topic, which is one of the things that I believe that many people are being affected. And many people have it and they don't know that they have it. Important and suspected stroke is a medical emergency. The safety message for the program is to seek emergency medical care immediately rather than waiting for symptoms to improve. Yes, sir. Let's get to the business of the day. Let's talk about stroke. This is one of the sickness that a lot of people, especially in Africa, are suffering from. Many people don't know about it. A lot of people know about it. Sir, what is stroke?
In a very simple term, I'm sure most of us must have heard about stroke, cardiac arrest, heart attack, and so on. But in a very simple term, stroke is just a sudden loss of blood supply to any part of the brain. And when this blood supply is lost or cut off, it is quite consequential. There must be consequences to the brain, which reflects onto the body, because the brain cells definitely need nutrients and oxygen to survive. Exactly. If any part of one's body is deprived of oxygen and blood with nutrients, the place starts going dead or black. That's gangrene, destroyed, dead. So also, it happens in the brain. So the brain cell starts within minutes dying, and that reflects in the symptoms that the patient may have. Different types of what can, the way it could come up, regardless of any time, as long as the blood supplies, which carries oxygen and nutrients, is cut off, is consequential. That is the simple terms to put it before we get into the nitty gritty.
Thank you very much. I really appreciate that. You laid the foundation very well, but I just want us to quickly get to some area of this conversation, which is very important. Last week we talked about malaria, and a lot of people have been talking about it. It's gone viral on our social media and also on many newspaper across the globe. Let's look at this stroke. Is this something that somebody can feel that is coming? Or is something that it work with age? Maybe you get to certain age, then I mean, you stand a chance that possibly it happened. How this take place?
Sudden loss of blood supply to the brain or cutting off of the blood can happen to any person, regardless of age. But commoner in old age because of certain factors, because these people are more prone to hypertension, diabetics, high lipid storage, which is cholesterol, because most times when you start growing older, you start getting lipid medication to reduce your cholesterol. And it is this same set of people always having sedentary lifestyle. They hardly do exercise, they hardly do anything that can, energize their body. So that's why it's most commoner in old age than in younger age. Still, there's increased prevalence of this word called stroke in younger age group. And this younger age group I'm referring to is between 18 and 50, which has not been very common before.
Wow. Wow. A lot of people believe that this is for the old age, but I'm shocked now when you mention that it's actually between the age of 18 to 50. So you mean that it's possible for somebody between the age of 20, 25 also to have it?
Yeah, definitely. It is called the young age group that are classified. They are classified as young age group between 18 to 50. It's been an upward trend in this set of people. Globally, it is believed that around 11.9 million of people will have stroke every year. And 1 in 4, that's about 25% of people, will also have stroke in their lifetime. And most common causes, we'll get to the causes as we go along, but about 70% of it will still, about 60% of it will still occur in those that are less than 70 years old. So it's very common. And in the younger age group between 18 to 50, there is an incidence of about 10 to 14% that can occur in that age group. And the causes are fairly different, mostly fairly different from those of the elderly. Because in those young age group, we have mostly because of burst in their arteries. That's the pipe that carry blood to the brain. It burst. Could be because of accident, could be because of neck injury or other problems or sports. It could cause that. And there's what we call cardioembolism, where there is blood clot in the heart that may travel to the brain. It could cause that. Some is because they may be obese, they may be eating lots of fatty foods and little fruits and vegetables. So they have hypercoagulable state. It may be, acquired or hereditary, like what we call familial hyperlipidemia. So that could narrow down the pipe that supply blood to the brain. As such, they may come down with stroke. Some of this age group, 18 to 50, they are indulged in recreational drugs, especially cocaine, marijuana, and amphetamines. So this will increase the blood viscosity and may make the blood thicker than normal. And some may be hormonal factors. This is very common in women, especially because of pregnancies. It increases their hormonal level, especially steroid, or it could be immediately after delivery, and maybe because of contraception. Those are the main causes, which is fairly different from the elderly who are having majorly chronic diseases like diabetes, hypertension that can make them more predisposed to stroke.
Oh, thank you very much, sir. I want to go a bit more deeper into the issue of the women, but before that, let's quickly look at this. About few years ago, let's say from 7 years ago, we have a coach, one of the Super Eagle coach, die of cardiac arrest. Uh, and people say that's because some people doesn't do exercise, but a coach of a team die of cardiac arrest. What could have caused that?
It's been known that some people that are very fit can still have cardiac arrest. It's very possible, because when we talk about the causes or the type, because there are different type of cardiac arrest, or there are different type of what can cause cardiac arrest, especially in stroke, different types, and cardiac arrest could come in different forms. It could be due to blood clots that travel from any part of the body. It could be dislodged. It could affect the heart the way it's affecting the brain, which is called the ischemic type of cardiac, the ischemic type of stroke. So if any of the blood vessels in the heart is affected, it could lead to damage to the heart, muscles, which could lead to cardiac arrest. And there are different type of heartbeats which may not be diagnosed, and the person is still very healthy, sporty, but if this happens suddenly, we call it arrhythmia. It may cause sudden cardiac arrest. So in that type of person, I think proper examination needs to be done, which we call autopsy, that could really confirm what could have caused it. But there are different types of ways in which it could occur, not just because one is fit. There are other problems that could be there. It could be due to high blood, sudden increase in high blood that could affect the heart, and the person could just slump and die.
Wow. All right, so let's quickly look at the warning signs, because I mean there must be some signs in the body. What are the warning signs and emergency response to that?
There are a few things that one needs to look at. It is given an acronym. So it could be either the fast acronyms or be fast acronyms. It depends on what is comfortable. But most of the symptoms you just follow a particular pattern. B may stand for balance. You see, when somebody suddenly loses balance or coordination, that should be a warning sign. Or sudden trouble seeing. When somebody starts talking about, I'm getting blurry vision, it's not just slowly, but suddenly. And it could be either in one eye or both eyes. And sudden shift in one side of the face, which we call drooping. When the face droops to one side, it could be a problem, it could be a warning sign. Or when one arm is weak or numb, suddenly the hand becomes weak or is numb, it may be a problem. It may be difficult to be raised up or difficult to be put aside. And speech is another problem. Sudden slurred speech. Somebody that's been speaking nicely, coherent, speech becomes slurred. There could be trouble in speaking, or people may find it difficult to understand the person, so it becomes a problem. And there's what is called T, because BEFAST, that T is the time. Very, very important. And that is why we say stroke is an emergency. You don't need to waste time about it, because the more time you waste, the more difficult it becomes for recovery. That is a very good point one needs to have in mind. In this situation, you need to be aware of the time. Make sure you are aware of the time when it starts, and call the emergency immediately. Because without that, it's a big problem. And once you call the emergency, what do you do? You make sure, because there are different numbers for local emergencies in any country. You call that number, inform them what you've seen and when it started. And then you make sure that you keep the person safe. You make sure the person is well rested. No food, no drinks. Switch into what is called ABC, where you make sure the airway is okay, the breathing is fine, and the circulation is okay. Then start monitoring while you are waiting. And while you are still waiting, you make sure the safety is prioritized, patient is still comfortable. You can easily discuss with the person can, answer you, and the airway, breathing, circulation is still intact. That is what to do.
Wow, thank you very much, sir. Sir, before a lot of people are joining us, and I'm getting some comments and also some questions. But before I attend to that, uh, what about when people sleep? Because this happened a lot, and you just realize that some part of your body is kind of paralyzed, like the blood is not flowing. Maybe you sit down somehow and you realize that your leg stiff or your arm stiff. That happened maybe sometimes. Could that be the sign of stroke?
Um, Not likely, because that's one you've just discussed is just because of a temporary cessation in the blood flow into a part of a particular part of body. It could be the arm or the leg because of the way you are sitting, or you are hanging your hands. Even you yourself will feel that you sense that something is wrong. You change your position. It's different from omnial signs of stroke. This one comes sharply, suddenly, and you feel that things have just drastically changed. Because even when you are experiencing the signs of stroke, I'm sure you do one or two things to see if things are getting back to normal. Or if you are not seeing, you can wipe your face and see, you realize that this is not changing. Your face is drifting, drooping to one side. It's not coming back. Your hand that is becoming weak it's not that you have any sudden sign that things is painful, because it will come as painless. It will not be painful. It will not be painful. Unlike the one you are describing, pain is associated with it, because it's the pain that will trigger you to change your position, which is quite different from what you see in stroke. Yeah.
Okay, one question is that, doctor, what normally block people's blood vessel?
Okay, good. There are different ways in which stroke can occur, and that's why we have different type of strokes. So this question, very good question, will take us to different type of strokes so that we can expatiate on it for people to understand. The commonest one is called ischemic stroke. This ischemic stroke is the one that is described as when the blood vessel is blocked. Blocked in the sense that it could be because of what we call thrombosis, and thrombosis is called blood clot. When there is a clot of blood that blocks the vessels, then distally, which is the other part that's the other part of the brain that the blood supplies to, is deficient of blood, and the blood cells start, or the brain cells starts getting damaged. So, and that begins within minutes. It could be by thrombosis. That's one aspect of the ischemic stroke. It could be by embolus. Embolus means blood clot that does not start from the brain itself. It starts from any other part of the body and gets to the brain. That's embolus. So others could be stenosis. Stenosis means narrowing down of the blood vessels that supplies the brain. And what can cause this narrowing? It is mostly called fat deposits, which is called arteriosclerosis. Commoner in obese, commoner in those that, having sedentary lifestyles, and those that are not having favorable or balanced diets, eat a lot of junks, processed foods or fatty foods. These fats are deposited in the blood vessels, so thereby narrowing the lumen, the size of the blood. of the blood vessels. So it gets to a stage where it totally blocks, and that causes ischemic type. Those are the three types of what can cause blockage in an ischemic type of stroke. We have other types like hemorrhagic, where the blood vessels get busted. It bursts, and there is overwhelming supply of blood into the brain. It increases the pressure there, and the brain is deprived of blood. The last one is called transient ischemic attack. We call it TIA. This one occurs spontaneously and resolves spontaneously, leaving no major damage. Sudden weakness, and that could be described in a situation where there is a block, there should have been a blockage, and maybe it got loose, and then the blood flows again. So a temporary cessation in supply, and that eases out, and the blood flows again. So it's called transient ischemic attack. It leaves no lasting damage. Thank you.
Oh, wow. Thank you very much. Those of you that you are connecting with us, kindly keep sharing this program and keep sending your questions. And also later in the program, we are going to open the line for you to call in to speak to Dr. Oluwatosin Ademola Ojo. All right, sir, let's quickly look at the one question. Okay, let me take this question. Say, then, in case someone has a cardiac arrest, what is the first step to revive the person?
Cardiac arrest is just the sudden cessation in the heartbeat. Cardiac. The first thing is you make sure the patient is breathing, because if the patient is not breathing, you can't resuscitate the heart. And with that is the first thing. You make sure the patient is breathing. If the patient is not breathing, you have to open up the airways by doing mouth-to-mouth resuscitation, or you have a bed, depending on where you are, that you can use to pump air. And make sure, and simultaneously, you attend to that cardiac arrest, because the blood flow has stopped. So you need to stimulate the heart by doing cardiopulmonary resuscitation. And that allows the C to come in, which is circulation, and the blood start flowing. Those things need to be done simultaneously. But when that happens, you can't do it alone. You call for help. And you make sure the patient is not in any danger zone. Because if the patient is in a dangerous zone, definitely you are endangering your own life. Because you must be safe before you can save somebody's life. You make sure you look at the environment. What must have triggered that? Is there anything dangerous? Is there anything difficult that you need to take care of first, where you are calling for somebody backup to assist you? Because there's no way you can do that and resuscitate that person's life. And you don't want to be in that situation too. That means there will be two dead persons at the same time. So it's always good to look out for environment, get a backup, call for help, because there are people that will be more knowledgeable than you in that environment. Call for them, make sure you attend to the air, do cardiopulmonary resuscitation in a controlled manner, and then make sure the circulation. Other things can follow up with that. Thank you.
All right, sir. Let's that take us to risk factors and prevention. What are the major risk factors for stroke, and how does high blood pressure increase the risk of stroke?
That's very interesting. From the little we've discussed so far, we understand that the risk factors are just very glaring and quite basic. High blood pressure is one of the risk factors, and high cholesterol. We've discussed all this before. High blood pressure will weaken the blood vessels in the brain, because persistently high pressure, even from our common household utensils, like holes, increase the pressure, you see how the force will come out from it. So high cholesterol will narrow down the pipe. It will increase that. There should be increase in the force of the heart to get that same the amount of blood that satisfies the brain to get to that place. So there will be increase in the force, there will be increase in the blood pressure. Then the weakened blood vessels can easily rupture, can easily break apart, and that may lead to ischemic stroke. And if high cholesterol continues, it will narrow down the pipe and may lead to ischemic stroke. Then type 2 diabetics, it predisposes to hypercholesterolemia, where there's increase in cholesterol formation and may increase the risk of stroke. Then cigarette smoking too weakens the blood vessels. It contributes to it, and it favors the deposition of lipids, which is cholesterol, in the blood vessels. And obesity, as we've talked about, definitely there is high cholesterol in the body. So that will be deposited in both, even in the tummy, in the blood vessels, in so many parts of the body. And as such, it will block the blood vessels. Lack of exercise, because if you do exercise, the tone of your blood vessels will be fit and firm and will be stronger than before. And that will reduce the depositions of cholesterol, which is lipids, fats in the body. So reduces the chances of having stroke. Then alcohol use, heavy alcohol use is one of those things, because most of the alcohol will be converted to fat, which will be deposited in the body, and it overworks the liver. So eating healthy living, healthy food intake is very, very important to reduce the risk factors to this. And there are some medications that can increase the risk. These medications are called blood thinners. They are given to those that may have either acquired or inherited problems with their blood. So it could be aspirin, it could be warfarin, which is anticoagulant, antiplatelet. So most people taking this must be very careful, because it needs to be monitored so that it's not too thin to increase the risk of stroke. Thank you.
Wow, thank you very much, those of you joining us. We already spent about 31 minutes on this program. You remember, this program is fully paid for by the Ademola Ojo. That is Dr. Ademola Tosin Ojo. That's all. To sensitize the community and also to let you know some of the important things that you need to know about your body, your health, and your life. And that is what is going on the African Portal Radio TV International. So when we come back, we just want to quickly open the line to receive few calls. When we won't come back, we look at the treatment and recovery, and we look at after a stroke. That will be where we're going to stop for this week. I suspect that we will need to conclude it next week, but if we can conclude it this week, definitely we will do that so that we can go to another topic. But let's open the line. But before we open the line and receive one or two questions, let's quickly look at the issue of women. Last time when you explained about the woman, especially during the pregnancy, and you mentioned that sometimes when women use some certain things to maybe family planning and all that, could that also be part of the things that can cause stroke for women, especially when woman is doing all this so-called family planning and all that?
Yeah, quite interesting. Not in all cases, but it, like we said, normally put it in medicine that it predisposes. It puts them at a higher risk than the normal population. Because when somebody is pregnant, there is increase in the circulating amount of steroid hormones in the body, which takes care of the baby. And everybody knows that when a woman is pregnant, there's increase in the weight. Obesity comes in. Not really obesity per se, but there's increase in weight. And this increase in weight comes from increase in the blood that is available, increase in the fat deposition in the body, because the body needs that for energy production, to carry the pregnancy on. So, and during pregnancy, women are not as active as they were before. So, leading to more sedentary lifestyle. They want to sleep, they are tired, they can't work. And all this will lead to increased deposition of fats in the body and reduced usage of those fats and sluggishness. So makes them more predisposed. And then during labor and delivery, you expect that there is increase in exchange of blood from so many aspects of their body. And during the recovery process, which is the puerperium, where which is we call postpartum, they are still at risk because the fat in the body is still there, and during breastfeeding too, which equally increases, fat deposition in the body because they need more energy to produce milk. So all this may cause blood, accumulation in the peripheral sites, especially in the leg and in the calf muscles, which will lead to clots. And when this clot is dislodged, it goes to the brain or the heart. So that makes them more predisposed. Also, contraception. It could be oral contraceptive pills. It could be the injectables. Most of these ones can cause weight gain and indirectly increases fat deposition in the body and making them more predisposed to heart attack or stroke. Thank you.
Wow, thank you very much for that clarity. I really appreciate that. And I believe a lot of women are joining as well, sir. I don't want us to, I know it's for another topic. We are still going, during this 13 weeks, we are still going to aspects where we're going to be talking about the woman health, man health, and all that. But is it possible for women not to use all this so-called stuff for the preventing them having pregnancy, family planning? Is it possible for women not to be using that, since this is causing some of the problem?
Yeah, it's very important. It's made simple because the clinicians are aware that there's a risk to some of these. So most of them are not encouraged to be used after 35 years of age, because the younger you are, the better for you, because your body will still be able to manage. You are still stronger and you are still younger. But after that age, there are few methods that can be used that will significantly reduce the risk that these contraceptives, especially the injectables and the tablets, will cause. And there are some that are having problems either in terms of in terms of hereditary, or they have special problems either with their blood or with their gene, and they may not even be able to use those type. And as such, we prescribe a different method, which could be, is generally called loops. We call it intrauterine contraceptive device that contains copper. It has no hormones. In this type of people, that is what we use. We insert it to the womb, it stays there, it sterilizes the sperm, doesn't encourage fertilization because the sperm is weak, and as such, no pregnancy. And it does not increase fat deposition in the body because it works locally. It's only within the womb. So there are different types that can be used for different categories, thereby reducing the risk that is inherent in those contraceptions. Others could even go permanent by doing tubal ligation, where the tubes are cut and it's permanent. You see?
All right, thank you very much, sir. I really appreciate. I believe women are watching as well, and there's a lot that we are going to talk about. I think that is taking us to the next topic of what is coming, so watch out for it. Let me open the line. Thank you for joining us. I really appreciate your time, and thank you for being part of this conversation this hour. Are you there? Hello?
Hello, doctor. Yeah, good afternoon.
Yes.
Can you hear me?
Good afternoon.
Always, sir.
Okay.
My question for this episode, my first question is, what are those things that normally block the blood vessel? And then the second question I have placed on is the cardiac arrest. What are the best way to coerce cardiac arrest, or what are those things that always cause cardiac arrest? And in case an issue or an emergency of cardiac arrest happen, what are the first aid to put? What are the first steps to do to revive that person? Something just happened like yesterday in Nigerian Football Premier League. A player was pronounced dead, and but to God be the glory, was rushed to the hospital, maybe to the first aid, but later he was pronounced being alive back just less than 24 hours ago. This is what I'm saying. What are the ways? Are you with me?
Yeah, we with you.
Ways, what are the first steps? what are the steps to take in case of emergency of cardiac arrest, especially to the sport people at the pitch or during the process they are doing the sport? What are the best way to revive them? What are the first steps, first aid to put in place?
All right. Thank you very much. I believe if you are joining us,
Yeah.
Doctor already deal with that question. The question one have been, he attended to question one and question two. But I'm going to allow him to talk briefly about that. But thank you for your call. I really appreciate it. Joining us means a lot to us. You are the co-host of this program, and you joining us is also an encouragement for us to continue doing this program. Thank you for your time. I really appreciate it. Keep watching it. Keep sharing it. Thank you. God bless you. Thank you so much. Bye-bye. All right. Okay, everyone. I believe, Doctor, you already do justice to that question, and you already attend to that question as well. So let's quickly move to the next part of this conversation because of our time, because our time is fast spending, and I want us to also have enough time to round up this section, actually giving people opportunity to call in. But unfortunately, I will need to pause the line because of our time. We are running out of time, and I believe you still have a lot of things to attend to on your own side as well before the time runs out. So let's quickly look at some aspect of this stroke, which after when somebody has been treated, is it possible for this thing to be completely healed? Then what happened after? Those are the two questions I want you to deal with. What happened after, and also can let me just read it out. After a stroke, can someone have another stroke again after you've been recovering from one and you are getting better? Is it possible for another one to strike again?
Yes, very important. It's possible. Because something has happened, something must have triggered it. If those factors are still there, definitely it's a keg of gunpowder sitting to explode. So when somebody has had a stroke, it's always very good to have adequate treatment. The first thing is to get involved in terms of recovery and then institute prevention. That's it. Because the causes must be identified, then prevent. That reduces the risk. But that doesn't mean it may not happen again, but it drastically reduces the risk. So once you've prevented, you should be expecting that it becomes a low risk situation. So very simple.
Wow, thank you very much, Asal. Before we go, I think we can round up this section with, if you could give the public just 3 things to remember about stroke, what will that be?
It's quite interesting to note that everybody should know that stroke is not only for the elderly. It can happen in any age group. Like we've discussed, young age group between 18 to 50 are very common. So it can happen in any age group. It is not painful. Remember, don't wait until you have pain. Once you see any of those signs, it is an emergency. And you should know that it can be prevented. So if you follow all what we've discussed, know the risk factors, work against the risk factors, those are the preventable factors, you are good to go. And at the same time, it reduces drastically your risk, but regular checkup is very necessary because there are few things that only regular checkup can bring about, especially your high blood, checking your sugar, checking your lipid profiles, checking your heart, make sure the rhythms are okay, it's beating well, there's no problems, because there are some, because of little problems in the heart, maybe hole in the heart may cause that stroke, may trigger that later. But if you are not aware, just like what the other person that asked questions said, there may be a bit of hole in the heart. And when you are doing exercise on the feet, it may be very small and it may trigger problems. It may cause arrhythmia and somebody may just collapse. But basically, ABC. Once you follow that process, get the patient to the hospital. You'll be fine. Thank you.
All right, sir. Before you go, sir, could job that someone do could it be another way for somebody to stand a high risk to get stroke? Maybe, for instance, some people say that if you are working in some company where they are making, where there is a lot of smoke, some people say that if maybe you are working where it's too dusty, maybe you are a painter, maybe you are a bricklayer and all that, all those kind of job, you stand a very high, chance to have stroke. Is that true?
Not necessarily, but anything smoke, just like tobacco, or any smoke that is, offensive, may be a problem because it could damage the heart, it could damage the lung, and it could damage the blood vessels, which may predispose you to weak blood vessels that may rupture and may increase the risk of stroke. Likewise, heart attack. But other type of work that could predispose you to that are those sedentary lifestyles where you just sit down, not moving, no exercise. It could predispose you to that. But any active work is good, combined with exercise. Thank you.
All right. Thank you very much, Doctor. I really appreciate your time this week again for you coming out to talk about stroke. And I believe those of you that you are listening to us, look after yourself, do check up. Regular checkup is very important, and always check your health. Go to the doctor, check where you are. Make sure you understand your body and do checkup. That is what the doctor is telling us, that there is no solution to it. You cannot detect it by you just thinking that, I slept yesterday and I wake up, I realize that some of my body paralyzed. Maybe I'm about to have stroke. Doctors say it may not be. Maybe the blood is not flowing very well to the part of the body that can cause that. But stroke may not give you any sign except you go for regular checkup. Go to doctor, go for regular checkup, check your cholesterol, and also check your BP. It's very, very important. These are the things that is coming to you. We don't have money to give you, but we have information to give you. And this is what we are dishing out right now, that you look after yourself, because your health is actually your wealth. So take good care of yourself and look after yourself. That is what this program is all about. Doctor, thank you very much for joining us. I really appreciate it. I believe that next week we are coming back. By the grace of God, we are coming back to talk about other things and also to talk about other topics that is very important to life. Doctor, I just want to say to you that you are actually giving us $1 million. Open check, because you are giving your time out to people. And I believe that anybody giving his time to people is actually giving the part of his life to people. And this is a sacrifice that you make to give to the humanity, to give to the people, to give to your community, which I really appreciate it. And I really thank you for that. Thank you for your time. I didn't take it for granted. I know you will have tell us, I know it's not possible. I have a lot of things I want to do. But because of the love for the community, because of the love for humanity, you say, no, I will be here to talk about some topics and things that I have to do. And I believe that some people are following us and people are learning one or two things from this program. And it's not only for today. It's actually for future. Somebody will come across this footage somewhere 10 years, 20 years time and still say, wow, some people have invested in our health actually before now. So thank you for your time. I really appreciate it, Doctor. Keep doing the great work you are doing in the community and keep smiling. God bless you. Thank you.
Thank you, moderator. I appreciate your energy and passion. Thanks, listeners. Enjoy your day. Bye.
Thank you so much. Bye-bye. Thank you. Thank you very much. All right, everyone. That is Dr. Ademola Tosin Ojo on the African Portal Radio TV. Another segment, another great time on the African Portal Radio. Stroke is what we talk about today. How to prevent it and also how to know about it earlier. So you don't sit on the fence and say, no, I'm not going to watch it. Watch it, share it, and tell somebody to also share it. Share it. Tell somebody to tell somebody to tell somebody. Doctor gave part of his life for us to come on this broadcast, to be part of this conversation, to educate us, to enlighten us, to sensitize the community, to tell you about your health, how you can look after yourself. Regular checkup is very important. We'll be singing that from the day one of this program. Regular checkup, regular checkup, regular checkup. Some people will say, no, just me. There is no such thing. If you keep on saying, just me, you may likely die and realize that after when you died, you are just starting working. So look after yourself. This is the only one life you have. There's no photocopy. Some of us live our life as if that there's a photocopy of our life. You smoke, you drink like a fish. All those things have side effects. Look after yourself. Do everything moderately. Make sure that you exercise. Check your health. Go for checkup. That is what we are dishing out on the African Portal Radio TV International. Your health is very important to us. That is why we designed this program, to help you, to educate you, to sensitize our community, and also to let you know that your health is actually your wealth. So you can make all the money, but if health is not there, it's a big failure. So look after yourself. Eat good food, sleep, rest where you need to rest, and at the same time, make sure you eat balanced diet. Don't just eat junky food. Eat balanced diet. Those are the very important things that you need to keep in mind. You will not discover this thing by highs. Some people say, let me see your highs. I can tell from your highs. Maybe you can have a stroke. Just go to the doctor, let them run a checkup on you. That is what we have for you on the African Portal Radio TV International for this week. Join us again next week, same time, same place, on the same African Portal Radio TV International. Thank you for your time and keep watching the African Portal. God bless you. Enjoy the rest of your day. Bye for now.